Well, the patient-controlled health IT bill puts the patient back in control of their medical record. And I believe we should put patients first in anything and everything that we do. This addresses the privacy aspect of it. It basically allows the patient to decide which providers have access to the record. And it also incorporates health information exchanges, which facilitate the spreading of the use of medical information as directed by the patient to make sure that it gets to the providers who need this information. So I think it's a good starting point. We'll set this up hopefully as a demonstration project, perhaps in 5 states, and then learn from it over the course of time to see whether, what's working, what's not working, as we try to introduce health IT. Well, a lot of states have taken steps by placing caps and doing other things to help reduce the incidence of these lawsuits. But there are 2 problems here. One is, of course, a large lawsuit with a payout as judged by a jury, which is typically you get a sympathetic jury and the case is not judged on the merits, and then you get a big payout. But the other is there are a lot of frivolous suits that are filed that never go anywhere, but those add to the cost. And there should be a mechanism by which these frivolous suits are weeded out. Certainly if you got a legitimate claim, that's one thing. But I think clearly to allow all kinds of frivolous claims to go forth adds to the cost, but it also adds to the cost going back to the patient because it creates a defensive medicine environment where a lot of additional tests are ordered. So we do need to address this. As I mentioned, states have done a good job in some cases where they've created caps, created medical review panels to look at cases. And I think at the federal level, we need to look at some new things. Perhaps a medical court is a way to look at this, where you have a specialized expertise in a court rather than a jury looking at this to help weed through what's frivolous and what's not. Americans want choice. They want choice and they want affordability more than anything else. And I believe what we ought to do is create health care policy that gives them that choice. And that also basically places proper emphasis on the doctor-patient relationship, because we're not going to have good health care unless we have doctors and patients who trust each other, build out on that doctor-patient relationship so that it not just treats sickness. You don't just treat sickness, but you're providing prevention, screening, and good health advice. So I think Senator McCain is on the right track with this, but I think we can go further. I don't think we ought to pick who pays for the insurance, whether it's employer or the individual. Let's create both options and put them on an equal playing field and let individuals choose what's best for them. Well, it's my hope that we'll move to a patient-centered system. As a physician, I know the great advantages of having a patient-controlled healthcare system. Again, you get back to personalized medicine, a doctor-patient relationship built on mutual trust that emphasizes health, not just sickness. But let me just say what happens when you go to a socialized medicine system. I know a heart surgeon who practices in England. Several years ago, when I was practicing heart surgery, I contacted him because I read something in a journal that I liked. It was an interesting paper he had written. And he expressed to me that he was extraordinarily frustrated. And I said, why? I said, you're at one of the top hospitals in the United Kingdom. Why do you want to leave? He said to me, we're 6 months into our fiscal year, and I've been told I cannot operate on any more patients for the rest of the year. I've met my quota, which means folks who need heart surgery in that area are not going to get it. They're going to have to wait. And you can imagine if you hit your quota 6 months into the year, those patients get pushed back to the subsequent year. And it adds year upon year. And pretty soon you got a pretty doggone long waiting list. Americans are not going to tolerate that. We want high-quality health care that's personalized. We want health care that basically everyone can get. And everybody should have access to a good doctor-patient relationship, because having just coverage in a government program doesn't mean access to good health care, a good doctor-patient relationship. And that's what most Americans want.